On today's episode of the Cancer Show, we are going to have an interesting story. For the sake of confidentiality, I cannot put the patient's real name here, but you indicate the patient as Ama and the friend as Akosua. But before we continue, kindly make sure you like, you share, comment, and make it viral so that this show can continue. Now to the issues on the ground. There are two friends, as I said, Ama and Akosua. Ama called Akosua last year and told her that, look, girl, I have a lump in my breast. What should I do? Because I went to the hospital and the doctor is telling me that I have to do some tests, some biopsy, and possible, if the biopsy report comes and it shows that it is cancerous, I have to undergo certain treatment. So as a friend who trusted her friend Akosua, confided in her, then Akosua came to spoil the matter. What did Akosua do? Akosua told Ama that, look, me too, as you are telling me, I went to the hospital and I had a similar lump, but girl, it's nothing. Oh, they say it is benign. Unknowing to Ama, Akosua had undergone a procedure known as biopsy, and samples have been taken from the lump that was identified, and even she has undergone a lumpectomy to take out the lump, and she has gotten the results that it is benign. But Ama trusting Akosua that, oh, if Akosua has had the same lump and she's not worried about it, why should I be worried about it as a friend? So she brushed it off, didn't talk about it again, and they moved on with their lives as good friends. They were chilling and all this while. About 2 months ago, Akosua didn't hear from Ama, only to get a phone call from Ama, and Ama was gasping for air, and she could hear monitors around her and people talking. That was when Akosua realized that Ama is hospitalized and she is in a critical situation in the hospital. When Akosua realized that Ama is in the hospital, then Ama told Akosua, girl, I should have listened to the doctor when he said I should take a lumpectomy and also take the biopsy and other tests. If it was cancerous, then I should have undergone treatment. Now they are telling me that the lump that I told you about, that Dr. Akosua, you advised me that, oh, lumps there, it is benign, it is cancerous, and now it has spread to my bones, to my lungs, to my liver and other organs. Hence, even the option of total cure is off the table. Akosua, realizing the grave danger she has caused to her friend and the disservice, she hung up the phone and dropped to tears. But you know, tears will not solve the issue right now. And as your favorite pharmacist who is in the oncology space, when I heard this story, I said, let me share with you. Not every tumor is cancerous. That doesn't mean that tumors cannot be cancerous. When a lump is identified in an individual, it could be benign, which is not cancerous, which is not malignant, or it could be cancerous. But this dissemination can be made from biopsy, scans, and other tests, which will be also confirmed by your oncologist or your doctor who is attending to you, not your friend. Please, if you've gone to the hospital and you've been diagnosed of any form of cancer, or there are preliminary investigations going on, please do not brush it off like what Ama did, and do not confide in somebody and take the person's word as an expert. Now there is benign tumor and there is malignant tumor. They all at the beginning might present the same, but from biopsies and other reports, you can know that this one is cancerous and If that's the case, you have to undergo certain procedures and certain treatment, including chemotherapy, it could be radiotherapy, surgery, but your oncologist will make sure that you get the proper care. Most people come to the hospital, especially with terminal disease like cancers, and it is too late. And mostly when they come, it had even moved from the early stages to the late stages. And most of them, their story is that a friend or a colleague told them that, oh, this one is nothing, you can go another route, you should explore spiritual route, you should, and all those things. But one thing you have to know is that cancer spreads very fast. Cancer can spread to your liver, almost every organ, depending on the aggressiveness of that cancer. So please, do not play, do not be like Amma, do not put yourself in that position. If you have a family relative who is diagnosed, or you have a friend who is diagnosed of cancer, encourage the person to seek proper care. Encourage the person to continue with the care with their oncologist so that they can see them to the end. If it's something that is salvageable, your individual or that person will be cancer free. Do not say I didn't warn you. I'm your favorite pharmacist and I'll be here next week. Now we know that there is a benign tumor which do not spread and which is not of seriousness. An example is lipoma or fatty tissues accumulation, something like uterine fibroids. All these are benign tumors which are not cancerous, hence will not affect other organs in your body or will not spread. But you have malignant tumors such as breast cancer, prostate cancer, colon cancer, a whole lot of cancers out there which can spread in a matter of months or even weeks, depending on the aggressiveness and the integrity of you, the human being. Do not be like Amma. I'll see you in the next one. Stay tuned. Make sure you like. I'm your favorite pharmacist, and welcome to the Cancer Show. Bye bye.